corresponding with an increase 4 times in overdose deaths. And as you've heard, 48,000 Americans died last year from drug overdoses. This year, that's projected to go to 60,000. That's just under 7 people every hour. We're doing our best with the partners that Dana has mentioned, with RxSafe Humboldt, working with our own colleagues in terms of more responsible prescribing, documenting better that we're looking at function and not just the absolute pain level. Keep in mind that the people that have overdosed are our friends and neighbors. I keep hearing about all of these homeless people that were being besieged with these urban refugees coming in and flooding our community. Our data says something quite different than that. The vast majority of these people own homes, have been in this county for more than 25 years, and are approximately 50 years old as an average. That's every one of us could fit that profile. So going forward, I'm emphasizing the previous statements that we need to not vilify, not stigmatize. This is a community problem. We cannot do it alone. I'll be here on the panel to answer questions, and I'm taking notes in regards to some of the questions.
We're going to be advertising those numbers. I don't have them with me tonight, so you can call them for, say, the pickup of meals that you're finding around. So the hope is, by this collection program growing, we can also, combat some of the issues of disposing of meals when we find them. Because right now it's really hard. What do you do with it, right? So we're working with our partners, and we'll be excited, and of course we'll let everybody know when we're ready to roll this out.
Thank you very much, Supervisor. We now would like to be able to go to our next panel. What we'd like to be able to do is move through our next panel.
Abscesses, and they're sleeping out in the streets, and they're doing unimaginable things to get the next fix that they had to get. And when we were able to be licensed to use buprenorphine in response to that, we started with a couple of people, and it was just the most amazing thing. I mean, I've done medical care in Humboldt County of all different kinds for almost 40 years now, and I haven't done anything that's been so predictably dramatic, so predictably helpful in transforming the lives of people who are desperately suffering. I was just so surprised and amazed. The one thing that really kept me going was there was a guy who had been injecting heroin on and off for like 40 years. He'd been in jail a number of times. He'd done lots and lots of things he was never proud of. And I had him on buprenorphine, and he was getting his kids back. He was going to work. He was cleaning up. And he said to me, "Man, this is a miracle." And so I said, "What do you mean by that?" What he told me was, I was clean before. I was clean for a long time, but for a year at a time, but every moment, all day long, that thing was on me. I just couldn't stop thinking about it. And it was work, absolute hard work to maintain that sobriety all the way through. I can put one of these things under my tongue every day. I can go weeks without even thinking about it. I can get a job, I can take care of my kids. It's just remarkable. And this is a story that we hear over and over and over again. It's very moving, and the reason that we kept growing is it was just so successful and so dramatic. So we grew our program, we developed this team-based approach. And so we had nurse case managers, and now we've hired some drug counselors. And so the way it works now is that we have 3 different phases of our buprenorphine program. We have, in the first phase, people come in and we see them every week. Currently we have something like 600 or 700 people that we're treating with buprenorphine through our clinic. A lot of people are coming to us a different pathway now through chronic pain.
1 minute, and I just want to make sure before you conclude, if you can just talk about, you just mentioned how many folks are coming through the challenge because of recidivism, right? And you can talk about that as well. But you have about 1 minute.
Well, not everybody's successful, but I have patients of mine that I've got for 5 and 6 and 7 years now, or functioning well, where people we didn't even know. So people do fail sometimes, and we don't have the intensity that maybe a methadone. Methadone is a different drug. Methadone is a full opioid agonist. Methadone is like more risky, requires more control. But it may be better for some people who don't thrive with